There is a saying that health is wealth, but perhaps a deeper truth is that a government is only as strong as its ability to care for its people. When a child falls ill, when a mother needs urgent care, when an elderly citizen requires treatment, the true test of government is not in promises made, but in systems built. And in Ogun State today, that test is being met with deliberate action. Under the leadership of Governor Dapo Abiodun, healthcare is no longer being treated as a service alone. It is being reimagined as a strategic investment in people. From primary healthcare centers in rural communities to specialist facilities in urban areas, the Dapo Abiodun administration is steadily building a healthcare system designed for generations to come. What is happening across Ogun State now is the enthronement of a healthcare ecosystem that is powered by innovation, strengthened by technology, and driven by a philosophy that every resident deserves access to quality healthcare. That's because Governor Dapo Abiodun understands that in healthcare, preparation is everything. After all, you don't wait for the rain before repairing the roof. One of the major transformations taking place is the digitalization of patients' records across public health institutions. Gone are the days when medical files disappeared into dusty cabinets or patients had to start their medical history all over again each time they visited a different facility. Today, healthcare records are becoming digitally accessible across levels of care. This means that whether a patient begins treatment at a primary healthcare center or is referred to a higher level facility, healthcare professionals can access relevant information more efficiently, leading to better diagnosis, faster decisions, and improved patient outcomes.
We're implementing the electronic medical records system, EMR, that has helped us in strengthening our healthcare delivery across the state, because we're implementing the hub and spoke approach where you go to the primary healthcare center, from there they refer you to the secondary, and from secondary they refer you to tertiary.
But technology alone is not enough. Governor Abiodun also believes that all hospitals must have the power to save lives when every second counts. That is why his administration is investing heavily in clean and reliable energy solutions for public health facilities. Across the state, healthcare institutions are increasingly being powered by solar energy, ensuring that critical services can continue uninterrupted.
We have constructed and renovated about 140 primary healthcare centers. And when I assumed office, very few, only a handful of health centers were actually truly functional. Today we have about 140 PHCs reconstructed. Not only reconstructed, they are equipped with solar-powered energy systems.
Yet, Governor Abiodun also recognizes another reality. For many families, the fear of hospital bills can sometimes be frightening as the illness itself. That is why the administration has continued to expand health insurance coverage across different segments of society. He is ensuring that access to healthcare is determined by need, not by size of one's pocket. Whether young or old, employed or self-employed, everyone can access quality healthcare through the state's healthcare financing initiative.
Administration has demonstrated that visible commitment to good governance with an inclusive and participatory model yield the tangible benefits of democracy.
But healthcare is not only about doctors, nurses, and hospitals. It is also about preparedness. A hospital without medicines is like a vehicle without fuel. It simply cannot function effectively. And Governor Abiodun is determined to ensure that Ogun State is always prepared. Today, that commitment takes another significant step forward. The governor arrives for the commissioning of the pharma-grade warehouse of the Ogun State Drugs and Health Commodities Management Agency, a facility built to safeguard one of the most important pillars of healthcare, the availability of essential medicines and health commodities. After inspecting the facility, Governor Abiodun describes it as a strategic investment in the future of healthcare delivery in Ogun State. For him, this is far more than a warehouse. It is a critical component of a larger vision to improve the storage, management, and distribution of medicines and vaccines across the state.
This facility is not merely a building. It is a strategic investment that will improve the storage, management, and distribution of essential health commodities. It will strengthen supply chain efficiency, reduce stockouts, and ensure that medicines, test kits, and critical health products reach healthcare facilities and patients across the 20 local government areas in a timely manner.
The benefits are enormous. From malaria and cholera to HIV/AIDS and other public health challenges, timely access to essential medicines can often mean the difference between recovery and tragedy. With this facility in place, the state is strengthening its capacity to preserve critical pharmaceuticals, reduce waste, respond to disease outbreaks, and ensure that healthcare facilities are adequately supplied when they need it most.
This achievement also underscores the importance of public-private partnership in healthcare delivery. Sustainable progress requires shared responsibility, collective accountability, and coordinated action.
With this facility, entire healthcare value chain in the state is strengthened and helps ensure that quality healthcare reaches more people more efficiently and more consistently.
Today represents a major milestone for us in Ogun State and in the continuous transformation of the health sector in Ogun State. And it demonstrates our collective commitment to strengthening healthcare systems, improving supply chain management, ensuring uninterrupted access to quality medicines and health commodities for our people.
What is happening in Ogun State today is bigger than the commissioning of a warehouse. It is bigger than solar-powered hospitals. It is bigger than digital health records. What we are witnessing is the gradual construction of a healthcare system built on foresight rather than reaction, and innovation rather than improvisation. There is an old saying that the best time to prepare for tomorrow is today, and Governor Dapo Abiodun appears to understand that principle well. By bringing together technology, clean energy, health insurance, modern infrastructure, and strategic planning, he is building confidence and resilience in the state's healthcare system. He is also building a future where every Ogun resident can have greater peace of mind, knowing that quality healthcare is not a privilege reserved for a few, but a right that is increasingly within reach for all.